Hi everyone. I hope you can all hear me, and please let me know if you can't. Welcome to Vermont Family Network's Lunchtime Webinar Series. Today our webinar is called Laying the Foundation, Building a Medical Home for Your Child. And our presenter with us today is Betty Morse, Family Support Consultant at Vermont Family Network. Before I hand it over to Betty and let her introduce herself and get going on the webinar, just a couple logistical things. First, you all have the option to call in and ask questions if you'd like, but you don't have to. Or you can type your questions into the question box that's at the top right corner of your screen. And Betty and I will both be checking on that, and we'll try and get to your questions promptly. And at the end of the webinar today, there will be a short survey that will pop up when you're done on your screen. And we really value your input, and it helps us with creating webinars in the future and workshops. So if you could just take a moment to fill that out, it's really quick. We would really appreciate it. And this webinar, as with all of our webinars, will be saved on our website, so you can go back and look at the slides and listen if you'd like. Also, don't miss our lunchtime webinar next month. The details are still coming, so stay tuned and keep checking back on our website. Now, here is Betty.
Hi everyone, this is Betty Morse, and I'm the Family Support Consultant, Healthcare Financing Specialist for the Vermont Family Network. And I'm so happy to be doing this webinar with you all today. It's my first one, so you'll have to take that into account. So we'll just go ahead and get right started. The webinar, Laying the Foundation, Building a Medical Home for Your Child. And we have some goals today. Some questions that we hope to answer for you is, what is a medical home? What are the benefits? How do I know if my child has special health care needs? Organizing your child's pertinent paperwork. We'll have a medical home checklist, and ideas and tips from other families, and as well as resources. So what is a medical home? Well, a medical home is not a building, a house, or a hospital. It's really an approach to providing healthcare services in a high-quality and cost-effective manner. It's about partnerships and how your child is cared for. It's really about that relationship that you have as a parent with your child's pediatrician or whatever the primary care provider may be. Medical homes are a new way of thinking about health care. They don't happen right away. They take time to develop, just like any other relationship. Medical homes don't all look alike, and you and your child's doctor create a medical home that works best for your child. And that's the key point there. You want to have something that works best for your child. So, in a medical home, you have a doctor who helps you keep your child healthy. And that's a really important part of a medical home, is that that part of the relationship building that you have with your doctor, that you have that really good communication. When your child gets sick or has other issues, the doctor and staff may suggest to you that other professionals should be included on your child's health care team. And that's an important thing, too, to have that conversation with your doctor, and your doctor to have that conversation with you about what other people may be needed on your child's healthcare team that may have the expertise that your primary doctor doesn't. In a medical home, care is focused around the whole child. You want to think of it like a puzzle. All the pieces must be looked into to see the entire picture. You might want to think about it as families who, I'm going to use Hurricane Irene as an example. their children may have had special health care needs in a park that was hit hard by the hurricane. So although they wanted their child's special needs to make sure they were getting services and things, but finding safe housing and drinking water, that stuff all had to come first. So when care is being looked at, you have to take everything into account. You also want to have your family at the center of care, and that they're really partners in making decisions about your child's health care. And that goes back again to that relationship and those conversations that the primary care and you, and as your child gets older, the child as well, talking about the decisions about where your child's health care is going. You also, in a medical home, want to know that your type of insurance is accepted, and I think most doctors do really well at that. They want to be able to, well, they want to be able to be paid, but they want you to be able to get your child's health care. So they try to accommodate that. And I probably should go back and say, during this webinar, by doctor, we mean the main health care provider who takes care of your child. And this could be a pediatrician, it could be a family doctor, a physician's assistant, or a nurse practitioner. So any one of those could be the primary care person who coordinates the care. So let's take a couple of minutes to talk about what are the benefits to a medical home. Well, medical homes promote prevention and early intervention by catching problems early to reduce visits to the emergency room and hospital stays. And anybody that has children knows that when they catch a cold and it looks like it's turning into something else, you want to catch that early and get to the doctor so it doesn't turn into something else, like pneumonia or bronchitis or something, so that they can get that early care to prevent something worse happening. Again, we go back to building a relationship between your family and your child's doctor health care team based on mutual respect. And I think a lot of parents, this may be the one that they find the hardest, because I think people, especially old-time Vermonters, were brought up to respect their elders and your doctor and your teachers, and I think for a lot of parents it's hard to speak with people in authority or people that they view as having more knowledge than themselves. But what parents have to remember is that when they're talking with their child's primary care, that they bring a lot of that knowledge that the doctor needs. They know the day-to-day living things of this child. They know when, if it's something of an illness, when it started, what were the symptoms. So I think parents have to think about that they are a really important person on that healthcare team, and excuse me, and should expect others to treat them as such. And I think once you make your you start talking, then it becomes easier the next time that you speak up. So a medical home opens up that sharing of information between your doctor and your family, and the communication improves how problems are solved and leads to better health and development for your child. You should be able to feel comfortable speaking to your child's doctor about your concerns, about their behavior, about their health, about development. I mean, that's all really important. So we'll take a few minutes to talk about how do I know if my child has special health care needs? And we're not talking about evaluation and that. We're really talking about how much time your child needs at the appointments, and when in different avenues and publications, when somebody says, well, this would apply to a child with special health care needs, this would answer that. So the American Academy of Pediatrics says that children with special health care needs are those who have or are at risk or at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also requires health and related services of a type or amount beyond that required by children generally. And this was adopted by the American Academy of Pediatrics in October of 1998. So children and youth, and we're talking about birth to 21 years of age, these are special health care needs that are recognized as those who have a chronic medical, physical, developmental, behavioral, or emotional condition and require a level of health and related services exceeding that of most children. So if we look at a 3-year-old's behavior, and they tend to have behaviors when they're 3. You're looking at something above and beyond a child's usual temper tantrum, that a 3-year-old's temper tantrum. We're looking at something way above and beyond that. And it would require a level of health and related services exceeding that of most children. So it would be at a level that is above and beyond. And the child might necessitate a care team of various professionals from medical, mental health, education, and social services. So this would go back to those referrals to other professionals that we had talked about earlier, where a referral to various professionals for medical could be to a neurologist. It could be to get an evaluation, so it could be to some sort of evaluator like a developmental pediatrician or clinic. Mental health, it could be to have a therapist or a counselor. It could be to have somebody from the designated agency that comes to your house and helps out with learning about his behaviors and how to handle them. And I shouldn't say just his, I should say his or hers. And education, lots of times the medical primary care person might come to, let's say, an IEP meeting, an individualized education program that your child may have. It could be the medical social worker that comes. So it could be a number of people that are added on. And social services, it could be that you get WIC. It could be that one of the parents receives Reach Up. So it's a variety of community and needed services. And so part of that doctor's or team's practice is to make sure that this variety of referrals are available to the family. So I've listed a few of the conditions here that, and this isn't an all list. This is just a small part of the list of topics, not topics, diagnoses that would be a special health care need. And it encompasses cancers, diabetes, heart conditions, hearing and vision impairments, Down syndrome, autism spectrum disorders, ADHD, bipolar and depression, cerebral palsy, spina bifida, or muscular dystrophy. So I tried to put a kind of a wide range of different ones just so that you could get an idea. So now we're on to organizing your child's pertinent paperwork. And as you can see, I think a lot of parents or a lot of individuals are inundated daily with tons of bits and pieces of paperwork and mail that comes that you just can't wait to get in the house and just put it in the trash because it's just unneeded paper. But when we're talking about our child's pertinent paperwork, we're talking about something different. It's the, well, let me go on and we'll talk about what is a care or resource book, which is one of the ways of organizing all that paperwork that you get when your child has special health care needs. And it could be those evaluations. It could be that IEP, that individualized education program paperwork. It can be reports from evaluators and specialists. It could be keeping notes of who you've talked to and contacts. But so what is a care? Excuse me. What is a care or resource book? Well, it's really a simple tool to help parents of children with special needs organize and keep track of information related to their child. And any parent can do one. It really isn't specific to just children with special health care needs. An individual could do one for themselves as well. But in this case, we're talking about children with special health care needs. And it's a 3-ring binder. Anybody that knows me knows I'm a binder person. If there's anything I have, it's probably in a binder. But in this case, it's a 3-ring binder with dividers and organizers that enable you and other caregivers to have all the pertinent information in one location. So some people will put all their information in there. Some people go as far as putting them in those paper protectors. It's a really great way to keep things in one place and organized. Well, the Care Notebook has numerous uses, but the major role is to help parents and caregivers maintain an ongoing record of their child's care, services, providers, and notes. You want to put in all those things in an organized fashion, and some parents, I always used to keep a picture of my daughter. I had the Clearview binder, and I keep a picture of my daughter in the front before I opened the notebook so that it would be very clear what this notebook was for. And then it would go right into the different sections. And it can be sections on school meetings. You can have the notes in there. You can have information in there that you yourself have gathered about the child's diagnosis. And it can have tabs on in the front, tabs on addresses and telephone numbers of all the people on the child's care team, all the people in the educational realm, whether your child's birth to 3 or 3 to 5 or 5 and up. And you can also in the front, it's a good idea to have a calendar. And you can just print them right off the internet, and they're free, so it's really nice. And then with your book, you can keep track of appointments, when meetings are going to be, when the OT's coming, when the SLP's coming. You could have a section in there where the SLP and the OT and PT or whatever else home visitors, because it could be a developmental educator coming as well, where they can put notes of their visits. So you can have that ongoing record. It's also a way to maintain lines of communication between the many providers and services that are involved with a child and their family. It's really nice for the providers who maybe you have a team meeting once every 6 months, depending upon the need for meetings. Some parents meet monthly with their team. Some meet every 6 months. It depends upon the severity and what the family and the team decides they need to meet. But in between there, the providers can get in and they could go, like the OT could go, oh, I wish I knew what the SLP was working on. You know, flip that old page, and there she has the notes from the last time the SLP was there so that they can really coordinate those things. So we've learned that a care notebook is really a planning tool. You can plan with it. Everything's in one place. You're not, pulling open those file cabinets and pulling out stuff. You're not pulling open that drawer in the kitchen with the stuff crammed in it. You have information right at your fingertips, and it's portable, so you can take it with you. You can take it to school meetings, doctor's appointments. I'll give an example. One time I was at a school meeting and we were talking about a subject, and I think it was a 504, and they said, oh, your daughter doesn't have one, and I'm like, oh, yeah, she does. And they weren't being mean. They just didn't know because there's turnover in staff. And I said, yes, she does. And I, of course, flipped open my book and I said, see, it's right here. And they all go, oh. So what that means is not only is it portable, but you have all that knowledge with you. It's not having to dig through that stack of papers. It's helping you to be a better advocate for your child, whether it's at school or at doctor's appointments or specialists or when they're in the hospital. It's helping you to have that knowledgeable voice about your child, because you have everything that years ago parents didn't have access to. And you can personalize it to best meet your needs. So somebody could give you a notebook with the dividers in place, but you could say, oh, I'd rather have this here and that there and this there. And that's what you got to do, because you want it to meet your needs. There are several examples of care notebooks on the web, and there's here I've put up a address at medicalhomeinfo.org, and there's a number of them listed there, including one developed by the Joshua Project in Vermont. So just remember that care notebooks are very personal to your child, and they should be customized to reflect your child's medical and education history and current information. You want to keep it up to date. At times I would take my daughters, and because there was so much information from year to year, I had a notebook that was a year, and then I'd carry over the pertinent stuff into a new year care book and then go on from there. I had that history by year by notebook. I warned you I was a binder person. So where do you get a care notebook? Well, parents can purchase the necessary components of a care notebook themselves at any office supply store, or you can contact VFN for a starter care notebook packet. You can download the suggestions for a care book on our website. We do have care notebooks for families who have children with special needs that request them, and you can just give VFN a call at 1-800-800-4005 if you'd like to request one. People can pick them up if they request them ahead of time. On a limited basis, we can mail them. It's whatever works best for you. And we really want to inspire you to create your child's own unique care book, and something that really works for you, makes you knowledgeable, makes you feel comfortable. So we're going to go on to a medical home checklist. And it's something that you and your doctor can use to begin to build a better medical home for your child. So you want to look at if you're valued and treated as the person who knows your child best. And I think here at VFN, that's one of our strong things that we tell parents. You know, you're the parent. You know your child best. You're the one that's with them day and night. You're the one that takes care of them when they're sick. You're the one that's in the hospital with them. You are the most important person on your child's health care team. I think that's really an important thing to remember. And as the most important person on your child's health care team, you have to become a very collaborative person and learn how to ask questions and how to state your opinion. I'm not sure that's easy for a lot of us when we first start, but we learn how to do that, and people here at VFN can brainstorm with you if you call about how to talk with professionals and get your point across, or help you feel more of a part of your team. So your family's culture and religious beliefs are respected, and your preferences for treatment and care are honored. We've really become a diverse community in Vermont. So it's important for doctors, primary care, to realize a family's culture and respect your religious beliefs. So, and once again, we talk about you and your child's doctor share respect and trust. You should feel respected and trusted, and you should also respect and trust your child's primary care doctor. If you don't trust your child's primary care doctor, excuse me, you might want to think about if this is a situation that's working out well for you. And you might want to think about finding a doctor that you can trust. You want a doctor that partners with you, your child, and others to meet your child's medical needs. And I think that's really an important part when we look at that sentence. It's that partnership, that you work with your doctor, and that's where that respect and trust come in, that you're both working together for your child's medical needs. You also want to make sure that your child receives his or her immunizations, well-child visits, child development checks, and urgent care when needed. I'll tell you a funny story. When my daughter was very small and we first went in to get her immunizations, and of course there's tons of them that first year, I'd read all up on what she had to have, and I went in with my little list, and I was just so impressed that they just handed me a list and said, this is what she needs today. And I'm thinking, oh, I don't have to keep track of this. I thought it was wonderful. You also want to have somebody that when urgent care is needed, that you feel comfortable calling and saying, my child really needs to be seen now. There's something going on, and it's something that has to be taken care of right off. Or somebody that you can call and say, we're on the way to the hospital, can you meet us there? Whatever you and your child's primary care has developed as the urgent care plan. Your doctor makes you understand the medical and or other diagnoses and the choices there are for treatment. And I think that's really important that if your doctor gives your child a diagnosis, or a specialist gives your child a diagnosis, and then starts to explain the choices for treatment, it's really important that you feel comfortable talking to your doctor about, what is this diagnosis? Can he give you information on that? Or where can you find information on that? He should be able to do that for you, because understanding that diagnosis is really important. And also, when he talks about the choices there are for treatment, you want to be able to understand what those choices are. So you have to be able to have that good relationship to talk to him and say, well, I heard what you just said, but I'm not really sure I understand what that means or why we have to do it this way. You should be able to do that because that's really important, that when you come to make choices, you have to be able to make an informed choice. And if you don't understand, then you can't make an informed choice. Your child's doctor provides helpful information to you and other members of the care team. So he brings his knowledge and he shares that with you, and he shares it with the other members of the team. And he or she helps manage your child's care. You need somebody that's going to help you along the way. And I've heard many parents of children with special health care needs say that that's a time-consuming thing, is managing and coordinating all that care and appointments and bills and paperwork and travel. So it's really important that you're able to talk to that doctor about it. He or she can help you find specialty care or other services when needed. That's really important. And he's in that community of the medical community, so he knows people to send you to that have the expertise that your child's going to require for, whether it's an X-ray or an MRI or a genetics consultation. Your doctor knows where to send you, and if he doesn't know, he can find out. Excuse me. If your child gets sick or has special health care needs, you feel supported. And I think that's really important, that parents want to feel supported when they're kind of in this realm of, my child has this, or my child's very sick. You need to feel supported and understood, and that you are given information about ongoing health concerns. You need to be up to date on your child's concerns. You need to understand what's going on, because you and your doctor have to make, or specialists have to make, sometimes some very difficult and quick, hard decisions. One of the other things is that your child's doctor connects you to support organizations for community resources. What's out there that your family might qualify for? It could be financial. It could be disability-specific resource, including parent-to-parent support. It's really helpful. A lot of parents find it very helpful to talk to another parent that has gone through what you're going through with your child, that you can learn from them. You can talk with somebody that's walked the walk, so you feel less alone, you feel less isolated, and you feel that when you're talking to somebody that it's so much easier knowing that you're not alone in the walk. And you know what to expect, because they can tell you tips that only somebody that's been there can tell you. So I've included some ideas and tips from other families about a medical home. And these are some of the things that they said. They said, when you're going to the primary cares or the specialist or wherever you're going, if you have questions, you prepare that list of questions ahead of time. Write them down. Bring it with you. If you have concerns, write those down. So before your visit, so that when you get together for that appointment, you have all the time with a doctor that you both need, because he has things he has to get done during that appointment. And you have your questions and concerns, so if you have them all done ahead of time, that makes it just that much more efficient. I not only am a binder person, I'm a sticky note person, and they used to show us, again, I'm telling you stories from my own past, when we'd go for her, it wasn't wellness visits, it was usually some medical thing that was going on. And we'd get shown in, and I'd sit in the chair, and I'd usually either I'd be holding her because she was young then. And I'd reach in my pocketbook and I'd stick out my sticky note that had my questions and concerns on it. And I used to stick it to my knee right on my pants. And so the doctor just learned after a while he'd just come in and he'd say hello to my daughter. And then he'd say hello to me. And then he'd say, is it okay if I take your questions? And he just knew I had my questions and concerns all ready for him. And that was the great kind of relationship that we had built. That he knew how I did things and that I was prepared. And beyond that, he wanted to answer my questions and hear my concerns. So when you go to the doctors, you want to be ready and comfortable to talk about the changes in your child's development or health, because they can't make informed decisions about your child to talk to you about unless they know all these things that only you know. And you also, I'm a big one on, oh golly, you want to celebrate those new skills as well. You want to take those chances to celebrate every chance you can. And the child's pediatrician wants to hear about those new skills and those new things that your child's doing, as well as talking about the concerns that you have. Again, ask for an explanation of anything you don't understand. That's really important. And don't feel that there's nothing that you can't ask, because you can ask for an explanation. And sometimes you might have to, when you ask and they say it again and you still don't get it, you might just have to say, you're going to have to say that a different way. For some reason, I'm just not getting it. And they want you to get it. They want you to understand. So you should feel comfortable asking questions and voicing your concerns. And that goes back again to that relationship, that medical homey part of it, where you feel comfortable asking questions. And it's okay to have a different opinion and respectfully voice it. And again, that's being comfortable enough to know, okay, I heard what you said, but I don't think I agree with you. And that opens up that line of communication that you both can talk about it. Because differences of opinion aren't bad. They're a way to open up conversations to talk about things. And what a dull world it would be if we all thought the same thing. Another tip that a parent had was to discuss with the doctor how to get after office hours care for your child. That's a really great tip. You want to know what to do when your child is sick or there's that emergency. What do you do? Lots of insurances will say you have to have your doctor's referral before you can do anything for your insurance to pay for it. So you need to have those answers ready and ahead of time. And again, one parent's tip was to make that binder a care book for your child that holds all your child's pertinent health information in an organized and portable manner. And this person said to include the names, addresses, and contact information for all the professionals on your child's health care team. And I would add to that to include school and special education contacts as well. One parent suggested to create a one-page summary or care plan about your child. Put it in the front of your care or resource book with the contact numbers for emergencies. It's right there. It's right there in the front. So you have it ready to take with you. Everything's in one place. The emergency stuff's in the front. And that's a really great suggestion. And one person said that their tip is to get to know the names of the staff people in your child's primary care office. What's that nurse's name? Who's the front desk person that answers the phone? And if the office has a social worker, what's her name or his name? It makes it more friendly because they certainly all know your name because they get your child's file out. So it's important to know theirs, and it just makes it more more comfortable. Now, the American Academy of Pediatrics developed a medical home model for delivering primary care that is accessible, continuous, comprehensive, family-centered, coordinated, compassionate, and culturally effective to all children and youth, including children and youth with special health care needs. So let's just break that down a little bit. What does accessible mean? Well, accessible means that it's easy to get to, it's nearby, it's easily reached, and you get care when your child needs it. That's what accessible is. Continuous is care is ongoing and there when you need it. There's nothing that's harder than, and if you take it as an individual, when you're working with somebody and then you have to work with somebody else. And then you have to work with somebody else. And then you have to work with somebody else. But if your care is continuous, these people know you, they know your child, they have all those records, so that care is continuous. It's ongoing. Comprehensive. Comprehensive is when your child's care is inclusive and takes in all of his or her needs. You're looking at that whole child. And the family's needs. Sometimes families' situations, they talk about it with the doctor. And then there's family-centered. What does family-centered mean? Well, family-centered care is an approach to healthcare that shapes healthcare policies, programs, facility design, and day-to-day interactions among patients, families, physicians, and other healthcare professionals. You can see medical homes sneaking right in there, can't you? Healthcare professionals who practice family-centered care recognize the vital role that families play in ensuring the health and well-being of children and family members of all ages. These practitioners acknowledge that emotional, social, and developmental support are integral components of healthcare. They respect each child and family's innate strengths and view the healthcare experience as an opportunity to build on those strengths and support families in their caregiving and decision-making roles. Family-centered approaches lead to better health outcomes and wiser allocation of resources, as well as greater patient and family satisfaction. And you know, that's really medical home in a nutshell. It's all about family-centered care. So we look at the word coordinated. Coordinated is when the primary care provider is overseeing and making sure that all care needs are being met. If there needs to be referrals to other health or community services, connections are made, services are happening, and follow-up is done. That's coordination. What's compassionate? Compassionate is when you and your child feel listened to and that care is given in a considerate and empathetic manner. And culturally effective? Primary care providers are providing care to an increasingly diverse child and adolescent population. They have to have an understanding and appreciation of cultural distinctions that lead to optimal health outcomes. Such understanding should take into account the beliefs, values, actions, customs, and religious faith of distinct population groups. So now we're on to resources, and a really great resource to learn more about medical home is the National Center for Medical Home Implementation, and the address is there, the web address rather. There's also the Center for Medical Home Improvement, and the National Center for Medical Home Implementation is a great resource for health professionals, families, and anyone interested in creating a medical home for children. So it's a great resource for not only families but for professionals as well. And the Center for Medical Home Improvement works to improve the quality of medical home for children with special health care needs by advocating and supporting partnerships, which we've talked about a lot today. There's also Bright Futures, and you'd have to go under Families and Communities, Tools and Resources, and you will find information on child health, development, and how to get the most out of your medical appointments. The American Academy of Pediatrics, that's a trusted site for general child health information or for more specific guidelines concerning a specific pediatric issue. And then there's Healthy Children, which is powered by the American Academy of Pediatrics, and it's for information for families on a wide array of topics. Yeah. So, as Vermont's federally funded family-to-family health information center, the Vermont Family Network is committed to helping families of children and youth with special health care needs and the professionals who serve them. Families and caregivers struggle to find the services their children need, and children with special health care needs and disabilities have chronic and complex needs. And our family support consultants are uniquely able to help families because they are family members who have had firsthand experience negotiating the maze of healthcare services and programs for children with special health care needs and their families. Our staff knows the issues that families face and help families make informed decisions. If you have further questions about a medical home for your child, please contact us. Our mission is to promote better health, education, and well-being for all children and families with a focus on children and young adults with special needs. Every child deserves a medical home. Does your child have one? And that, does anybody have any questions before we go? You can type them in, I think. Yep. Did you need it back?
All right, so thanks everybody. Thank you, Betty, very much. And if anyone does have any questions that they think of after, you can feel free to call us. Betty put the number up there that you can call us at. And also, this will be on the website in a couple of days, so you can go back and review anything that you'd like. So thank you all for being here, and join us next month.